Hello and welcome to the award-winning Waterman Wellness. Your pathway to health and wellness with local experts is your guides. I'm Alyssa Hritzik. We have a lot of healthful news you can use in this episode, including this Umatilla woman explains how breast reconstruction surgery has helped her feel normal after a double mastectomy. Severe pain in your abdomen could be due to gallstones. Stay tuned to learn about the condition and advanced treatments. And a board-certified vascular surgeon explains the dangers of carotid artery disease and advanced treatments to help patients. Our top story is important news for North Lake County residents. A significant investment is underway to enhance emergency care and more. Recently elected officials, civic leaders, and community members joined the Florida Hospital Waterman team for a groundbreaking ceremony.
We're finally breaking ground on this project that is designed to really expand our emergency room that is way beyond capacity. Designed for 55,000, we're currently seeing close to 68,000 patients a year through this space, so it's time to build, it's time to expand, reduce the wait times, improve the environment that we deliver care. The expansion of the ED is actually part of a eventually 6-story tower, but 4 stories right now. We're going to have additional services, kind of expanded services on the second floor for women and children. We're going to shell out additional spaces in the 2 floors above that for future growth.
The expansion's going to be adding almost 30 beds, so about 25 beds to the entire emergency department. It's going to allow every patient room to be private. It's going to add a specific area for children.
We'll be having larger labor and delivery rooms. We'll be having private rooms for postpartum patients as well as the pediatric patients. And it's going to be a family-centered approach.
It's a significant investment in our community. It's about $73 million or so.
Community leaders have stepped up to help raise money for a portion of the project.
Our campaign is to raise $5 million of that. Really what our $5 million does is puts the icing on the cake. And so we're able to do some extra things for the hospital and for the emergency department that they would not otherwise be able to do. I believe the North Lake County people see the need and they want to have excellence in healthcare.
Adventist Health System now has been in our community since 1992. We want to make sure that we are the healthcare partners here in North Lake County. And we have the emergency department growing, but we also have the nursing home that's in the middle of being built today with an opening date of around February 2018. And that's a beautiful state-of-the-art nursing home, 120-bed private room facility for our residents as well. So lots of cool things happening, but Lake County deserves it.
You'll find more about the expansion projects at the Tavares Hospital at fhwaterman.com. Next, we turn to a condition that may prompt a visit to the emergency room. According to Lake County board-certified vascular surgeon Scott Hannum, carotid artery disease is a common cause of stroke.
And it occurs in the carotid artery. It comes right up the neck, dives underneath the jaw, and basically feeds one of the main blood supplies to the brain. So carotid artery disease is plaque buildup in the carotid artery, which is a large cause of ischemic strokes, where little blood clot breaks off, travels up into the brain, and then a small part of the brain can die. The vast majority it's picked up by their primary care doctor. They listen with a stethoscope, and it's just basically a swishing noise. It doesn't tell you if there's a 20% blockage or a 90%. But if there's noise, then they will typically get an ultrasound of the carotid artery. And that will give a pretty good idea of is it small, medium, or large problem.
Dr. Hannum says some patients are treated with medicine and lifestyle changes. More severe cases may be helped with advanced surgical procedures.
There's 2 treatment options in regard of surgery, which is called a carotid endarterectomy, versus a carotid stent. So still probably 95% of all advanced carotid disease is treated with surgery, a carotid endarterectomy. And that is opening up the neck about a 3-inch incision. The artery just lies right underneath there. It's about the size of a pencil, 5 or 6 millimeters. You open up the artery the long way and literally peel out the plaque. Sew the artery back together, close the skin. Takes about an hour. Most people are in the hospital for about 24 hours. A stent would go through the groin, needle procedure, come up to the neck, put a stent in there and expand the blockage. They're not going to generally feel any different. You're doing it to lower their risk of a chance of a stroke. That's the predominant reason. If somebody's had a stroke, and they need their artery fixed, we'll fix it, but that won't eliminate the stroke, the damage that was already done. It will not reverse that.
To learn more about resources for vascular disease, visit the website fhwatermanheart.com. Our next story addresses a condition that can cause severe abdominal pain. Gallstones, and if left untreated, they can be dangerous.
Gallbladder is a storage organ which is situated under the liver bed. It helps to store the bile. Sometimes the gallbladder forms the gallstones. We exactly don't know how people will form the gallstones, but there are various risk factors like obese patients, females, and diet may be the responsible. And usually we don't treat the gallstones unless it gives us symptoms. They get stomach pain, mainly the abdominal pain, mainly right upper quadrant, just below the rib cage on the right side or in the middle of the abdomen, especially after they have a fatty meal. Then sometimes what happens, the stones might migrate down, comes to the bile duct and blocks the bile duct.
The consequences of leaving gallstones, especially when you're symptomatic, are twofold. One is, if the gallstones, they can obstruct the opening of your gallbladder. So the bile pressure builds up. You can get an infection, and then you get what is called acute cholecystitis. And patients can get extremely sick from it. They would have to have their gallbladder removed on an emergent basis. The traditional approach in the old days before the advent of laparoscopy was to do it as an open procedure. But now with laparoscopic gallbladder removal, it has revolutionized the treatment. In fact, patients go home in a couple of hours, and the older approach, which involved the open cut, patients would stay in the hospital for 4 to 5 days.
Dr. Bhaskar says the body adapts to not having the organ.
Gallbladder, as I said, is a storage function. It just stores the bile. Sometimes what happens is when they take the gallbladder out, the bile goes directly into the bowel. Most of the time, no, it doesn't affect their digestion. They'll have a normal life.
Visit the website on your screen to learn about the advanced laparoscopic procedures available here in Lake County. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. Postpartum depression is more common than you think. We'll hear from a Tavares specialist as well as a young mother who was helped. This local plastic surgeon explains why a surgical procedure to help women after a mastectomy is so rewarding to him. And we'll visit the Con Recreation Health Center kitchen for a recipe that helps build up your immunities. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery. And you'll also find a listing of the specialists featured in this month's episode. First, you and your loved ones might want to make plans to attend these community events. We'll be right back.
Time for the Creation Health Tip of the Month. Eating nuts greatly lowers your risk of heart disease. Today, commit to eating a handful of your favorite kind daily.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Alyssa Huritzik. Our next story is about a surgical procedure that can make women feel whole again after a mastectomy.
I have family history of cancer, and my aunt actually had a scare, and she was told about the BRAC test, and that led me to go to my doctor. My mom was diagnosed when I was, I believe, I'd say around 12. So like I said, she battled it for about 4 years. And so just kind of thinking about with my daughter, if I can avoid, you can only control so much, but if I can avoid that, go ahead and take a step in that direction.
After testing positive for the BRCA gene, known for increasing the risk of breast cancer, Shannon Cox decided to have a double mastectomy.
They started the reconstruction actually at the same time as the mastectomy. They went ahead and put the expanders in at the same time. Because of me being healthy and the tissue and everything being healthy and having so much tissue there, the extra skin, they were able to go ahead and start that right then.
Cox asked Tavares plastic surgeon Peter Marzek to do the procedure.
When a woman comes in for a consultation and she wants to proceed with an implant type reconstruction, the first thing we'll do is measure her. We'll make a set of measurements that will help us decide how big of an implant, what shape of an implant, how much projection she needs.
I didn't want to be any bigger than what I was before. I just wanted to be back to normal. And he did let me know before it all started that he felt that he could give me that. Just to put the same clothes back on and feel the same on my clothes. That was my end result that I was hoping for.
Breast reconstruction as a plastic surgeon is perhaps one of the most fulfilling surgeries we do because of the fact that you're taking somebody who's at a very difficult stage in their life. They've got a lot of decisions to make, and it's nice to be able to sit down and try to guide them through that.
You'll find more information about options for breast reconstruction procedures by visiting fhwaterman.com. Having a baby is supposed to be a joyful experience. But for some new moms, the transition to being a parent can be very difficult. Tavares specialist Joel Hallam wants women to know that postpartum depression is common and treatable.
Any woman that develops postpartum depression obviously is a very serious thing, but the most crucial portion of postpartum depression is actually realizing that it's there. And I think educating the patient throughout her pregnancy and after she delivers is the key. Next, there's resources in the community as far as counselors we can help connect patients with, and there's medical management that we can help as far as medication that can help curb some of those symptoms as well.
It kind of started feeling like with the overwhelming.
Deborah Nolan of Tavares recalls that the stress of caring for her first baby, David, and keeping up with other responsibilities while adjusting to little sleep became too much.
Having to do what I need to do to be able to take care of the baby, especially when you're breastfeeding, there's a lot of demand that's required of the mother to make sure I'm eating, sleeping, making sure that he's being taken care of. And then of course there's the stuff around the house.
When Nolan went for a regular postpartum checkup, Dr. Hallam's practice partner, Mamie Rogers, recognized something was wrong.
And you can tell I was very stressed, and she's like, "What's wrong?" And all of a sudden, I just started crying. I just couldn't hold any emotions back, and the staff was great. They took the baby away for a little bit so I can talk to the doctor. Dr. Rogers talked to me. She talked to me about what I'm experiencing, making sure first, of course, do I have any feelings about hurting the baby, but that never came to mind.
Nolan says the doctor prescribed medication to help and also stressed that she reach out to her family.
It's hard to ask for help, even just for the little things. It was hard for me to ask someone to help me do the laundry, to do the cleaning, the cooking. She also made some other good suggestions, of course, trying to get outside. I think the main thing was to socialize, socialize with people my own age.
Nolan, who is doing much better, has advice for other new moms.
It gets easier. It definitely gets easier. Don't let that overwhelming feeling get to you. It's okay to cry. And of course, try to talk to people. Talk to other women who may have been feeling like this. If you're able to, just take a break. Have someone take the baby for the day that you trust, and just have your day.
You'll find plenty of resources for new moms by visiting fhwatermanwomen.com. It's time to visit the Conry Creation Health Center kitchen, where the team recently showed me a recipe that is delicious and can help fight off illness. Did you know that certain foods can help build your immunities to certain illnesses? Today I'm here with Florida Hospital Waterman Executive Chef Tom Sewell and Nutrition Specialist Ellen Boyer. Ellen, do you want to tell us a little bit about what we're cooking today?
So we're doing a blueberry, spinach, and cantaloupe salad with basil and spiced pepitas.
Sounds delicious. So Tom, do you want to get us started?
Yes. So what we have here is we have some spinach, cantaloupe, blueberries, balsamic vinaigrette, fresh basil, feta cheese, and some pepitas, which are pumpkin seeds. So we're going to take some spinach.
The spinach, the cantaloupe, as well as the blueberries have antioxidant effects and also are high in vitamin C. And these are going to help with infection fighting, and they also help promote those white blood cells.
Again, you can, if you don't like cantaloupe, you want to use honeydew, you can use honeydew, you can use strawberries. We're going to use the pepitas, which are real simple. All we do is we just toast them. We're going to put some in now. We're going to put some on top as well. Just toast them in the oven, about 350 degrees. Just some salt, pepper, and they're really, really good. Okay, and then we have some basil. What I'm doing with the basil is it's going to tear the basil a little bit. It's going to just tear it like that. It's real simple. Okay. This way, a lot of times if you cut the basil, it ends up bruising it. You don't want that.
So the basil, as well as the berries and the cantaloupe and the spinach, and then also the pepitas will also have anti-inflammatory effects, and these help to reduce inflammation and help with immunity. The pepitas are also high in zinc and magnesium, which also will help fight infections and help to increase your white blood cells.
And then you just want to garnish it a little bit with the pepitas. Okay. There's your salad.
Well, that was fast and easy.
Sure was.
Thank you very much, Tom.
Thank you.
So if you would like to try out the blueberry cantaloupe spinach salad, you can visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the September episode right here on Lake Sumter TV for some of the following stories. If you suffer from joint pain, you'll want to watch next month. A Lake County orthopedic surgeon will explain osteoarthritis and advanced treatment options. Some residents spent their summer vacation helping a community far away. You'll hear about their amazing experience. And we'll go back to the Con Recreation Health Center kitchen to learn about an ancient grain. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Huritzek for the award-winning Waterman Wellness.